White House Press Secretary Kayleigh McEnany joins us now from Washington. Kayleigh, good morning. As we just heard, the president said Dr. Fauci wants to play both sides of the equation. What exactly did the president mean by that?
Well, what the president means by that is they disagree on this issue. They're on opposite sides of the equation on this. President Trump does want to open schools, and I would note that Dr. Fauci later in his testimony did say that he doesn't believe school reopenings need to be linked to a vaccine development. The president believes we can safely reopen. He's cognizant of the many working parents out there who are having to be teacher, mom, dad, spouse, and play all of these different roles. The American people are in a very tough spot, and President Trump wants to reopen safely. That would include schools.
Does the president still have confidence in Dr. Fauci?
Yes, he does. He takes into consultation the advice of Dr. Fauci, but also that of Dr. Birx and also that of Stephen Hahn and Admiral Joie and all of these experts. And then he makes the best decision based on the data presented to him. There's a lot of voices, and as Dr. Fauci noted, he is one among many.
A new CBS News poll, Kayleigh, says that 62% of people trust Dr. Fauci, just 38% trust the president. What do you make of the distance between those two numbers?
Well, I believe that the American people have a lot more trust in the president than that poll indicates. They've looked at this president and they've seen a president who has managed to deliver more N95 respirators than the healthcare industry uses in an entire year. In fact, 3 times more. We were told that there would be a ventilator shortage, but this president has managed to secure 100,000 ventilators in 100 days. Again, 3 times more than what is produced in the average year. They've seen a president at work, and I believe the American people have great confidence in this president's leadership.
Health officials have been saying that we're going to see spikes, and if we don't handle the spikes correctly, they could become outbreaks. What is the president doing to manage the spikes so they don't become outbreaks?
That's a really important question. As we reopen, the president said that we will see embers here and there, so small outbreaks that we have to be able to manage. And basically, when you see an outbreak, the state governments, many of them have put into place contract tracing plans that they've shown the federal government that allow us to isolate an outbreak and immediately put it out. And I did speak with Dr. Birx, and she said we've seen many great success stories of being able to put out these outbreaks. She noted one in Iowa, and she did say to me yesterday when I spoke to her around 5 o'clock that she has not been seeing a link between mobility and increase in cases, meaning that in Florida, for instance, in Georgia, for instance, we're not seeing, as these states become more mobile, an increase in cases. And that's because of a great testament to the American people who are social distancing, who are washing their hands and not touching their face and listening to the advice of the experts.
The president says we lead the world in testing, but many health officials say we still don't have enough. Only a small percentage of people in this country have been tested. What is being done to further ramp up testing as we push to reopen? Because so many health experts say it's essential.
It's an important component for sure, but here's what I'd say to testing is, first, we are doing far more than Europe. In fact, 2 times more testing than most European countries, but we have enough to do strategic testing. Each governor has put in place a plan that they've delivered to us saying, this is the testing I need to approach phased reopening. And I've sat with Admiral Joie in task force meetings and seen him pull out a sheet and say, X state, you've requested this. I'm ensuring that you have this to enter phase 1 reopening. So we do have enough for strategic testing to enter phase 1.
We saw that Wisconsin has reopened on orders of the Supreme Court there, and then we saw crowded bars in the evening. Are you concerned about that happening as cities reopen?
Look, it's incumbent upon every American to engage in social distancing, to wear a mask if you feel that you need to at that moment. It's a recommendation by the CDC, not a dictate or not a mandate, but a recommendation. But nevertheless, you should wash your hands. You should take into account these practices. And in Wisconsin, the citizens of that state need to do the same because we want to safely reopen, and we can't emphasize that enough.
All right, Kayleigh McEnany, thank you very much for being with us this morning.
Thank you.